extend to you a warm welcome and wish you all a very best as we embark on your parliamentary journey. Honourable members, this marks the end of my announcements. A big hand of applause to the newly elected honourable members. Thank you.
General business. Item 2B, presentation of committee reports.
Honourable members, as in reference to our standing order, the order paper for today, the first presentation there comes from the Committee on Health on Malawi current situation, comes from the Committee on Health on Malawi current situation on public health financing. Honourable Chairperson for the committee.
Yes, First Deputy Speaker, sir, I confirm that the committee...
Honourable member, hold on. Get to that folder that has been delivered to you. There's something written on the front of that folder. That's the motion you're going to move. Order, honour members. Order. Order, honour members. Order, honour members. Let's resume our seats. Chairperson for the Health Committee, you have the floor.
Mr. Speaker, sir, I beg to present the paper standing on my name under item 2B of the order paper. Thank you.
Chair, keep standing. Sergeant Adams. Chairperson, do you want to speak to your report?
Yes, First Deputy Speaker, sir.
Please proceed.
Mr. Speaker, sir, although Malawi's public health financing system continues to operate under significant strain, with health expenditure remaining heavily dependent on external support, it is evident that Malawi has made notable strides in maintaining essential health services despite persistent fiscal pressures. The development partners continue to contribute a substantial share of funding for critical programs including HIV, AIDS, malaria, maternal and child health, and immunization services. Mr. Speaker, sir, while this support is deeply appreciated, it underscores the vulnerability of our system to external shocks and shifting global priorities.
Honourable Member for Lilongwe Chiwamba and your friend, order please. Order.
This is why today, Mr. Speaker, sir, I rise to present findings and recommendations of the Health Committee on the current status of public health financing in Malawi. The committee, Mr. Speaker, sir, conducted a series of engagements with key stakeholders from December 2025 to March 2026. These consultations brought together representatives from government ministries, cooperating partners, civil society organizations, the private sector, among others. Their insights have been invaluable in shaping a clear picture of where we stand, the challenges we face, and the opportunities before us. The budget framework. Mr. Speaker, sir, the committee observed that the health sector budget rose by 24% from 630 billion in 2025-2026 fiscal year to 783 billion in 2026-2027 fiscal year. Yet, the 9.3% allocation of the national budget towards the health sector falls well short of the 15% budget declaration commitment. First Deputy Speaker, sir, the Cancer Center needs at least 80 billion a year, but only 15.9 billion was allocated. Teenage pregnancies continue to rise, with adolescent birth rate increasing from 28% to 32%. In rural areas, Mr. Speaker, sir, stories of teenage pregnancies and child marriages are mind-boggling. The figures are obscene. The birth rates exceed 40%, exacerbated mainly by cultural practices, poverty, and myths about contraceptives. The drug financing was reduced from 10% to 3%, worsening stockouts in rural areas. The borehole drilling underwash is now determined by policyholders rather than technical experts, eventually undermining its sustainability. Mr. Speaker, sir, nutrition allocations have dropped sharply, with early childhood development reduced by 93%, from 13 billion to 0.9 billion. Quite unfortunate. Though the school health and nutrition allocations stand at 544 million, its utilization rates remain low, with only 40% of dispersed funds used. We need to pay an eye on this. What really is a problem? Donor dependence. First Deputy Speaker, sir, your committee observed that the Malawi's health sector spends about $565.6 million annually, with 47% funded by donors. Public financing accounts for only 25%, with private sector raking in 28%. Mr. Speaker, sir, this August House should know that the withdrawal of U.S. government funding in January 2025 cut $61.5 million, representing 8% of the health sector budget. The UK government, another traditional donor, reduced its support from 14 million to 4.9 million pounds. First Deputy Speaker, sir, these reductions threaten HIV, TB, malaria, and nutritional programs. Nutrition commodities remain donor-dependent, and dwindling external resources have created major gaps. As if this is not enough, the USAID withdrawal has created a major crisis, with 547 million lost since 2012, directly affecting nutrition supplies. Donors such as the Global Fund may also be affected, raising concerns about sustainability of HIV financing. Domestic financing efforts. First Deputy Speaker, sir, government is implementing many health financing mechanisms, such as introduction of paying wings in district hospitals. Kasungu District Council, for example, constructed a paying ward using JSAID funds. The paying wing is generating well above 40 million a month, In Nchao district, the paying wing generates at least 558 million monthly, while Zomba Central Hospital earns 200 million monthly from its paying wards. These initiatives demonstrate the potential of cost-sharing mechanisms to supplement health financing. However, Mr. Speaker, sir, accountability and clarity on revenue use remain a challenge. There's a need to put in place guidelines and regulations on the expenditure of revenues generated from paying wings. Mr. Speaker, sir, we have observed district allocations for nutrition remain chronically low at 337 million, representing only 0.3% of ORT transfers. Malawi requires a whopping 3.9 trillion over 5 years to meet nutrition needs, averaging 770 billion annually, but only 337 million has been allocated. It's a sad reality, but we hope something can be done. It's high time, Mr. Speaker, sir, we dealt with stunted growth and dwarfism. This committee, Mr. Speaker, sir, appreciates these funding cuts and challenges, but we will be selfish if we do not commend the government for making allocations such as 1 billion Malawi kwacha for RT co-financing, 1 billion Malawi kwacha for recruitment of health workers, and 2.4 billion for sample transportation, 500 million kwacha for capacity building, and 256 million kwacha for saver maintenance. Gaps in health financing. Mr. Speaker, sir, heavy reliance on donor funding continues to pose risks to this country. Fragmented reporting systems and limited interoperability of digital health platforms hinder efficiency, while community-based responses remain underfunded. Furthermore, Mr. Speaker, sir, disability financing is grossly inadequate. Institutions such as Makoda remain underfunded. The 500 million kwacha disability allocation is a drop in an ocean for the people differently abled. Mr. Speaker, sir, childhood development allocations dropped by 93%, undermining long-term health outcomes. Nutritional governance challenges persist. Delay in passing the food and nutritional bill, weak visibility of the Department of Nutrition and under-resourced data systems remain a big issue. Achievement. The challenges facing gaps, not with understanding, Mr. Speaker, sir, your committee observed that Malawi made the following commendable progress. 1, the country achieved the 95 HIV treatment targets ahead of the 2025 deadline. New HIV infections fell by 87% and AIDS deaths by 82% between 2001 and 2004. ART averted an estimated 53,000 deaths, while PMTC prevented 8,400 infections. 4, nutrition achievements include the launch of the National Multi-Sectoral Nutritional Policy and Strategic Plan 2025-2030, development of IMPO guidelines, rollout of complementary feeding guidelines to 13 districts, review of operational tools to integrate baby-friendly hospital initiative, and outreach campaigns reaching 1.3 million farmers. 5, recruitment of additional health workers and capacity building allocations demonstrate commitment to strengthening safe delivery. 6, introduction of paying wards in Kasungu, Ncheu, and Zomba Central Hospitals, among others, show innovation in health financing. 7, investments in server maintenance and data licensing support improved monitoring. And 8, by quarter two of 2025-2026 financial year, 24,377 clients were assessed for PrEP, that's pre-exposure prophylaxis, with a 90% enrollment rate. Recommendation. To address these challenges, Mr. Speaker, sir, your committee recommends the following. 1, that the Ministry of Finance, working with the National AIDS Commission, progressively increase domestic financing for HIV and broader health programs and adopt result-based financing mechanisms for CSOs. Number 2, that the Ministry of Finance, in partnership with the Ministry of Health, implement phased increases in domestic financing for procurement of ARVs and align budgeting with long-term supply chain needs. 3, that the Ministry of Health, in collaboration with the Global Fund Country Coordinating Mechanism, increase domestic resources for TB, mainstream gender equity and funding requests, and strengthen TB national plans. 4, that the Ministry of Finance and the Ministry of Health and Sanitation adopt innovating financing mechanisms such as earmarked taxes on sugar, airtime, Kabaza services alongside cost sharing and paying wards. Number 5, that the Ministry of Finance progressively increase nutrition allocations to at least 2.2% of the national budget, earmark the new 20% exercise tax on powdered soft drink flavors for nutritional financing, and introduce ring-fenced nutritional budget lines across all 12 mandated MDAs. 6, that the district nutrition allocations be increased from the current 0.3% to 2.5% of ORD transfers, and that all MDAs include nutritional programs and targets in their program-based budgets. Number 7, that adequate funding be provided for data systems. Number 8, that a national health fund be established through the enactment of the National Health Insurance Bill. Number 9, that the Ministry of Finance, together with the Ministry of Gender, increase budget allocations for assistive technologies such as wheelchairs, glasses, and hearing aids, and introduce tax waivers on imported assistive devices. Number 10, that the Ministry of Finance, working with the Malawi Revenue Authority, introduce a disability levy, potentially from road users or alcohol consumption, to contribute to the Disability Trust Fund. Number 11, that the Ministry of Health and Sanitation, in collaboration with the Central Medical Stores Trust, strengthen procurement and supply systems to ensure adequate stocking of medicines for disabilities. Number 12, that Parliament, working with the Ministry of Local Government, allocate a portion of the Constituency Development Fund specifically to persons with disabilities. Number 13, that the Ministry of Education include school health and nutrition indicators and budget lines in its program-based budget, and that early childhood development allocations be increased in line with NESIP targets. Number 14, that Parliament request clarification on the delay in tabling the Food and Nutrition Bill, and that the Department of Disaster Management Affairs mainstream nutrition into climate resilience and disaster response. Number 15, that the development partners provide predictable financing aligned with MNS, and that CSOs strengthen advocacy for nutrition commitments. That the Ministry of Health and Sanitation and Department of Nutrition adopt a financing roadmap aligned with N4G Paris commitments. Number 17, that the Department of Nutrition be repositioned under the office of the President and the Cabinet. Number 18, which is the final one, Mr. Speaker, sir, that the Ministry of Health and Sanitation and the Ministry of Justice expedite the enactment of the Food and Nutritional Bill. In conclusion, Mr. Speaker, allow me to take a sip.
Please.
Thank you.
You can do so if you trust the honourable member who brought it.
In conclusion, Mr. Speaker, sir, your committee believes that our health sector stands at a crossroads. But being at a crossroads has not made us to stop walking. We are walking and we are making progress. This committee, therefore, Mr. Speaker, sir, I would like to commend the government for the notable strides made in strengthening the health sector over recent years. In particular, the progress achieved in the fight against HIV is highly commendable, with expanded access to testing, treatment, and public awareness significantly improving health outcomes and the quality of life for many citizens. The government's sustained commitment to maternal health has also yielded positive results, including increased access to skilled birth attendants and improved antenatal and postnatal care services, contributing to reductions in maternal and infant mortality rates. Equally noteworthy are the efforts to address neonatal newborn health, with targeted interventions aimed at reducing preventable deaths through improved care in the early stages of life. Furthermore, Mr. Speaker, sir, investments in health infrastructure, including the construction and rehabilitation of health facilities, as well as the expansion of medical equipment and supply chains, have enhanced service delivery, particularly in undeserved and rural areas. Despite these challenges, the committee recognizes that several challenges remain. These include disparities in access to quality health care between urban and rural populations, shortages of trained health care personnel, inconsistent supply inconsistent supply of essential medicines, and limited funding to sustain scale existing programs. With these remarks, Mr. Speaker, sir, I beg to move that the report be considered and adopted by this august House. I beg to move. Thank you.
Honourable members, we can do better. We can do better. Thank you very much, Chairperson. Honourable members, that was a well-presented report and very positive on the issues the ministry is doing. We would like to applaud this relationship between the Ministry of Health and the chairperson of the Health Committee. It is positive to the development of this country. Please, bravo, keep doing it. Can I recognize the seconder? Can I recognize the seconder of this report? A member of the committee who would be seconding? I can see the honorable member for Mwanza
West.
Mwanza West. You have the floor, madam.
Thank you, First Deputy Speaker. First Deputy Speaker, it is with admiration that I rise to second the report ably presented by the Honorable Chairperson of the Health Committee, Dr. Anthony Masamba. First Deputy Speaker, your committee observed that Malawi has made significant progress in public health financing. We celebrate the attainment of the 95 HIV treatment targets in adults ahead of schedule, the reduction in AIDS-related deaths, and the prevention of thousands of infections through the prevention of mother-to-child transmission of HIV program. We also commend the launch of the National Multi-Sector Nutrition Policy and Strategic Plan, the rollout of complementary feeding guidelines, and outreach campaigns that have reached over 1 million farmers. These achievements demonstrate that when resources are directed effectively, Malawi can deliver results that save lives and strengthen communities. First Deputy Speaker, your committee further observed that the government has taken steps to increase domestic financing. Allocations for ART co-financing, recruitment of health workers, sample transportation, and capacity building are commendable. District innovations such as paying wards in Kasungu, Ncheu, and Zomba Central Hospital, just to mention others, just shows that co-sharing can generate substantial revenue. These efforts point to a growing recognition that Malawi must begin to live within its means. First Deputy Speaker, however, your committee also noted that challenges remain. The health budget continues to fall short of the Abuja Declaration target of 15%. Donor dependency is still high, with nearly half of health expenditure funded externally. Reductions in donor support, particularly from the United States and the United Kingdom, have created major gaps in HIV, TB, malaria, nutrition programs. Nutrition allocations have declined sharply. Early childhood development has been cut by 93%, and disability financing remains grossly inadequate. First Deputy Speaker, your committee recommends that Parliament and government act decisively. Domestic financing for HIV, TB, and broader healthy programs must be progressively increased. Innovative financing mechanisms such as earmarked taxes on sugar, airtime, and Gabaza services should be adopted. Nutrition allocations must be raised to at least 2.2% of the national budget, with district allocation increased to 2.5% of ORT transfers. Disability financing should be enhanced through tax waivers on assistive devices and the introduction of disability levy. Early childhood development and school health and nutrition allocations must be ring-fenced and the long-delayed Food and Nutrition Bill should be tabled without further delay. Mr. Speaker, Mr. First Deputy Speaker, it will interest you to know that this bill has taken 17 years without being implemented. First Deputy Speaker, in conclusion, this report is both a celebration of progress and a call to action. It reminds us that Malawi has the capacity to achieve remarkable results, but also that sustainability requires bold decisions, innovative financing, and political commitment. I therefore urge honourable members to adopt this report.
Order to my right. Please proceed.
I therefore urge honourable members to adopt this report and support its recommendations so that our healthy sector may stand strong, resilient, and inclusive for generations to come. First Deputy Speaker, with these very few remarks, I beg to second.
Congratulations, Honour Member for Mwanza West, for those seconding sentiments. I know it is not easy to rise, but the young people are now shining. We are very happy with that type of expression. Congratulations. Honour Member, the report has been presented and seconded. We will now ask the House to add their voice to the report. I see the Honourable Member for the senior for Doa Mpuzu constituency. Doa Mpuzu, you have the floor, sir.
Thank you, Mr. First Deputy Speaker, for granting the people of Doa Mpuzu the floor to add their voice to the report presented by our able chairman. Mr. First Deputy Speaker, I agree with the report that the chairman just presented and seconded. I agree with all those sentiments. The facts are very clear, Mr. Speaker, that our health sector is in troubled waters. We have a nation to manage, but we cannot manage a nation when our health sector is in tatters. They say a health nation is a productive nation. In other countries, Mr. First Deputy Speaker, you cannot win a seat. People cannot vote you if you cannot outline your health manifesto. We are lucky here that we come in and most of our people never put their health as a priority. We are voted maybe based on the NIF and other things. But in other countries, we will not even make it coming to here. Mr. First Speaker, we've been talking about the health financing for too long, and it's time for action. The truth is we cannot afford not to invest in the health sector. The cost of inaction is greater than the cost of investing in our people. For every kwacha we invest in health, we are saving ourselves so much greater cost in the future. We are preventing illnesses. We are reducing absenteeism. We are increasing productivity. And we are building a healthier and a more resilient nation. It won't be easy. It will require to make tough decisions, to prioritize our resources, and to make sacrifices. We will need to rethink our budget allocations. We will need to make tough choices. We will need to work together to ensure that our health system is sustainable. Mr. First Deputy Speaker, I believe we can do it. As Malawians, we are capable of making decisions. Collectively, we can, with collective efforts, we can yield a healthier and a more prosperous future. We deserve a healthy nation. it is not pleasing that we have the common person, the people that cannot afford anything, rotting in our hospitals, just waiting to be referred somewhere. We can sacrifice ourselves, we can give, we can contribute to make this a reality. Mr. Speaker, Mr. First Deputy Speaker, let's support this report and its recommendation. Let's show our commitment to improving the health of our nation. With these few remarks, I support the report.
Thank you. I see the Honorable Senior Member for Kadabe Chinteje. You have the floor, sir.
Thank you very much, First Deputy Speaker. First Deputy Speaker, I stand to support the report presented by the Chair of the Health Committee and ably seconded by Mwanza West. Chair, I stand here. If I'll take you back here. You remember, you and I were together in the Health Committee of 2014-2019, where you were a very able deputy chair, which committee was chaired by another very able person, Honorable Juliana Lunguzi, Davesa Lunguzi. You remember we went around the country where people were lamenting about the services in our hospitals. Especially when they go to hospitals, they are given a prescription and told, go and buy the medication. It's like, Chair, where you go to in your home, where you tell the children that you have got a timetable of meet on Monday, meet on Wednesday, meet on Friday. But come Monday, there's no meat in the house. It means you are as good as you are not able to provide. So as a country, we need to be making decisions, because people, when they are told to go and buy medication, some of them go to buy very expensive medication. So, during that time, when we did the survey, people were going to the extent of saying it's better to be paying a little something in hospitals and find medicine rather than go to a hospital and not find anything. But I'm comforted by the new government. I know that I've got so many programs. I believe in the health sector will be also one of them. Chair, also standing here as a former Deputy Minister of Health, I know most of the problems that I'm talking about. It's really time we did something. We cannot continue depending on donors. Donors are like tourists, here today, there tomorrow. They go back home. And with no apologies, of course. Because once you have somebody assist you, there's a limit to how much they can assist you. So I know the national cake is very small, but we need to be prioritizing. There's talk about the health insurance, about taxes in some of the services that we have in the country. I know maybe people are already burdened by so many taxes, but maybe it's time to look about other things that would contribute to the national kitty. Because most of our, in the health sector, most of our funding comes from donors, especially the vaccines and things like those. You remember when the United States of America withdrew the aid, it was like a catastrophe. We had to scale down on some of the services that we offer to people. So it's about time maybe we started taking good care of the little that we have. Because, of course, also a pilferage of medicine in hospitals, of course, now it's not as rampant as it used to be. It's going down. So that, again, I commend government going with that effort, the previous government as well as this one, that we really need to take care of the little that we have in hospitals so that it goes to people who really need it. Hospitals should not be a place where our people go just to wait to die, no. But they should, when they go to hospital, they should go there with hope that they will get the services they need to get cured. And also, I know that honorable members, I also included, we get a lot of messages from our people, sometimes sending prescription. I was prescribed this kind of medicine, please can you assist me? So a lot of honorable members here do that. They assist their constituents with medication. Even though sometimes people don't appreciate much because they don't know what honorable members of parliament do. They were just here to get allowances, yet it's not the issue. Whatever we get goes back to the constituents, the people who voted for us. They really benefit from whatever little we get here. So it's as if we assist government in that way. But those who are not in this house who may not know about this benevolent service that members of parliament do. It's unless you go through that, that's when you know that really honorable members, they are like a walking ATM machine with their constituents. So with those few remarks, Honorable Chair, I support the report, and I also commend the able Honorable Minister of Health. She's doing a great job. She's really doing a great job. It's not just because you are continuing with my health post in my constituency, no, but I've seen that you are really carrying the mantle very well. Keep it up, Honorable Minister. You really need to assist the President, because the President has got an agenda. He wants to leave a legacy. He cannot do that on his own. It depends upon the honorable ministers. A good number of you, almost all of you, are very capable honorable ministers, so please continue doing a good job. With those remarks, Honorable First Deputy Speaker, I support the report.
Thank you. Thank you. I recognize Zomba City South, but before you, sir, there is a point of order. Is it on the ATM machines?
Mr. First Deputy Speaker, I appreciate the report that has been tabled here, but is it in order that we can continue discussing it when it has not been circulated? Some of us wanted to see what is inside it, the recommendation, so that when you are commenting, should be directly to the report. So I beg you for your guidance on the same. Thank you.
Your point of order is sustained. Can I request the honorable member for Chikwawa West, who is our IT liaison with the Secretariat, to immediately, if you have it, post the report. If she's not in the house, Chair of Chairs, or your Vice, or the Chair of Health, please post it on the two members' forums, so that honorable members can follow. You rising?
Yeah, I've posted on the main group.
Oh, you have it?
Yep.
Yeah, so honorable members, be assured, the second of the motion of the report has already posted it. And thank you very much, Madam, for saving your sister, Honorable Chikwawa West, your neighbor too, because you guys, you honorable members, are neighboring constituencies. I've already recognized the honorable member for Zomba City South, and then after that, we'll go to Lilongwe Mapuyu South. Then we have one more. The last one on this report will be in Katabe North. In that order, 5 minutes, honorable members. Thank you.
Thank you so much, First Deputy Speaker. And through you, I should also thank the Chair of the Health Committee for the wonderful presentation, and also member for Mwanza West for seconding. First Deputy Speaker, I would like to start by congratulating the Honorable Minister of Health and Sanitation for the wonderful work that she's doing under Kuruguta Moyo. Under Kuruguta Moyo and the able Minister, we have seen several things that the Chair of the Health Committee has mentioned, but also need to add some. These include the capacity to start manufacturing medicines. Our Committee of Health and Sanitation, we are informed about this and we're very excited. We spend a lot of resources importing medicines from outside. If the country starts manufacturing its own medicines, Honorable First Deputy Speaker, we are going to save most of the forex that we dearly need. We have also noted efforts to motivate the human resource for health. Honorable Minister, I would like to congratulate you, because an unhappy health workforce cannot give you the results that we need as a sector. So congratulations. I've also noted with gratitude efforts being made by the Minister and the government in reducing drug pilferage. Drug management is essential, and we spend a lot of resources buying medicines, and if we are not serious on how we manage the resources, we end up losing. So, Honourable Minister, congratulations. I would also like to congratulate the Minister and the health sector on efforts being made in increasing domestic financing. The Chair has already mentioned that most of our donors in the health sector are going back home, and therefore the resources that we need to provide to the Minister of Health should start coming from within our country. So domestic financing is very critical. In this regard, we have noted with concern and happiness that the optional paying services are being provided in the central hospitals. Honourable First Deputy Speaker, there are a lot of us who can afford to pay for services. But here we are, we queue in the government facilities, opting to receive free service. This cannot continue. Let's probably start contributing to the optional paying services so that the mega resources that the health sector has can be used to better use. I should also commend the efforts that are being made in terms of medicines and supply chain. We noted also as a committee that we also need to start strengthening the warehousing of our medicines. Most of our warehousing is being rented, and we spend a lot of money paying for those warehouses. It's high time we also as government started investing in warehousing of our medicines. Let me also touch on the capacity to provide a quality assurance for our medicines. The Pharmacy Medicines and Regulatory Authority is mandated with this mandate, but I think the capacity to do this is limited. We are told as a committee that on level 1, they need to go to level 3, and this is the area that we also need adequate resources to support PMRA to do this noble cause. Finally, Chairperson, we need to stop looking at health as just a disease. It's a sector that is very necessary for the other sectors to function. A healthy person is the one that can be productive. And therefore, let's stop looking at health as just a department or a ministry that is managing diseases, but a ministry that is also a very good ingredient in terms of economic development of our country. So I support the report from the Health Committee, and I also like to implore all of us to support this report. I thank you.
Thank you. Honourable Member, you have the floor. 5 minutes.
Thank you, First Deputy Speaker, for giving the people of Lilongwe Mapuyu South an opportunity to contribute to the report. It is a very good report, and it's a very good conversation that we are holding right now as we just passed the budget. I think the people of Lilongwe Mapuyu South would want to support the report, and that as a country, we really need to start owning the health sector and making contributions. It is indeed, First Deputy Speaker, quite disheartening that there are a lot of inequalities within the sector. Above the underfunding that the report has highlighted, there are inequalities that we need as a country pay attention. Because whilst indeed we are all agreeing that our health sector is facing a lot of challenges, it seems that we have public hospitals for the poor, and we, particularly as politicians, have another type of health system. It's something that we have to pay attention to. Most of the feeder clinics, when we talk about Lilongwe Mapuyu South, Mingongo, Mbangombe, Chileka, you find the situation very bad. No beds. In most cases, patients are not given medicines. And their only option is perhaps to rush to Kamuzu Central Hospital. So I would want to request the committee as well as the minister present that whilst we are indeed increasing financing to the health sector, let us also look at the issues of inequalities. It is sometimes quite very bad, First Deputy Speaker, that we see in social media patients that would need medical attention either in private hospitals or even outside the country, they are fundraising in a very bad shape. And yet, when it comes to us as politicians, it is very easy to get to India. So it's my plea that these inequalities have to be addressed. The last part, First Deputy Speaker, as I contribute to this particular report, is the issue of policy consistency. Much as the paying wards are a good start, and that hospitals can also generate their own funds, we must exercise caution. Because it is very possible that the hospitals will now focus on the private paying wards. And definitely the public will be asking, what is it that I cannot get in my own hospital and that I can only get it in the private ward? Those inequalities we must pay attention to those. And I think Honorable Minister of Health is quite aware that recently the state president, Professor Arthur Peter Mutaliga, ordered that public officers in hospitals, public hospitals, should not be owning private hospitals. So the issue of having paying wards, if not controlled, if not properly managed, would turn the public hospitals into private clinics and only accessible to those that have money. Thank you, First Deputy Speaker.
Thank you, Lilonge Mapuyu. Leader, I already recognize the last one, who is in Katabe North, if it pleases you. Honourable Member, you have 5 minutes. Thank you.
Thank you very much, Mr. Deputy Speaker, sir, for giving the people of Katabe North to contribute on the health report. Mr. Deputy Speaker, sir, I want to summarize. My report is about maybe a summation of what the chair for the Health Committee has presented in this August House. Health sector allocation is below the Abuja Declaration. By the target of Abuja Declaration is 15%, but we are still below 15%, we're about 10%. Secondly, high donor dependency, about 47%, which makes our pose significant hard job to reach or to do in the health sector. Thirdly, Mr. Deputy Speaker, sir, inadequate funding for nutrition, disability, and the rehabilitation program. Also, this has been highlighted on the health sector, on the health report. Challenges in healthcare financing, including fragmented report system. Mr. Deputy Speaker, sir, the health sector budget allocation is concerning. We need to do better. We must prioritize increasing domestic financing to meet the Abuja Declaration. Mr. Deputy Speaker, sir, the report highlights our reliance on donor funding. How do we plan to address this dependency and ensure sustainable healthcare financing in our country? Mr. Speaker, sir, also the report indicated nutrition and the disability program are underfunded. We need to allocate more resources to address these critical areas so that this sector must be paying attention to the country. Mr. Speaker, sir, the Disability Trust Fund is grossly underfunded. I propose introducing a disability levy, as the committee indicated some levies. to Disability Trust Fund. Mr. Speaker, sir, this might be my recommendation to the report, that implement innovation financing mechanism like earmarking taxes, cost sharing, and others. Also, we can increase the health sector budget allocation to reach 15% for the next coming budget. And also to strengthen health financing system and data usage. Prioritize nutrition and the disability program in budget allocation. This on the next budget should take in action. Lastly, Mr. Speaker, sir, maybe there's a possible question we can pose on it. That what strategy will the government implement to address the funding gap in nutrition and disability? Secondly, how will the Ministry of Finance ensure sustainable health care, financing, and reduce donor dependency? As we know that the donor, they have already gone. And now we have to use domestic funding to...
Honorable Minister, Deputy Minister, please order. Thank you. Thank you.
Thank you, Mr. Deputy Speaker, sir. This was the question which I said we need to pose in ourselves, and then we should have an answer in the Ministry of Health. That how will the Ministry of Finance ensure sustainable health care, financing, and reduce donor dependency, since the donor have left and they are no longer funding the entire country? Secondly, thirdly, what plans are in place to increase domestic funding for health program and meet the Abuja Declaration target? As we know, we are still below 15%. With these few remarks, Mr. Speaker, sir, I second the report and I beg to move. Thank you.
Thank you. Honourable Member, thank you very much. Honourable Member, before the leader, you were not seconding this report. It was already seconded, so you support the report. Thank you very much. Leader, you have the floor.
First, Deputy Speaker, I rise to move that debate on the report as presented by the chairperson be curtailed to allow for the chairperson himself to wind up. I beg to move.
Thank you, Leader. Honourable members, I hope the energy is like yesterday's. We have a motion on the floor. The motion is to curtail debate on the report for the chairperson to wind up. Those of that opinion say aye. Aye. Those of the contrary opinion say no. The ayes have it. The motion is carried. Chairperson.
Thank you, First Deputy Speaker, sir. First of all, I would like to express my gratitude to all our members who have contributed positively towards our Health Committee. Our valuable submissions, statements in support of our recommendations and findings are so progressive. First Deputy Speaker, sir, health should no longer be taken as a social issue. Let me emphasize on that one. Health should no longer be taken as a social issue. Health should be taken as a business issue. That's why, as a committee, we are not only proposing working with Minister of Finance and Minister of Health, we are now proposing working with the Minister of Trade. Why are we saying that? Because we know that when health people produce, they will sell their products to Minister of Health, to Minister of Trade. And the income generated through Ministry of Trade will be invested in the health sector. As a result, we'll have more essential drugs, more medical equipment and supplies that will improve not only service delivery, but also access. There were talk about PMRA. It's true, First Deputy Speaker, sir, that we need to empower PMRA. There are regulations that are stuck in the Ministry of Justice that are not being approved, that are crippling the operations of PMRA. As a committee, we would like to see these regulations passed, because without these regulations, PMRA will not be able to carry out their duties effectively, eventually leading to
Honorable Chair, I know Malawians are listening, so when you use abbreviations like PMRA, would you please make sure Malawians understand what you're talking about, for them to follow you? Thank you.
Thank you, First Deputy Speaker, sir. PMRA stands for Pharmacy, Medicines and Regulatory Authority. This authority is failing to carry out its duties effectively because they do not have the regulations. But during our interactions with the PMRA, they told us that these regulations are stuck with the Ministry of Justice. It is our wish that these regulations be approved for the PMRA to start working effectively. Because without these regulations, First Deputy Speaker, sir, that's why we are having these falsified and substandard drugs, which are contributing to MRA and microbial resistance. On top of that, First Deputy Speaker, sir, we need to clarify, as a committee, we are not advocating for out-of-pocket payments. What we are advocating for is introduction of paying wings. And these paying wings should take into consideration the vulnerable people. We don't want the vulnerable people to go into a health facility and start paying out from their pockets. There should be proper guidelines and proper mechanisms that will make sure that these paying wings are managed properly. We don't want our people, the rural people, to be punished by the introduction of paying wings. So we need to make it very clear. We need to make it very clear that while we appreciate the introduction of paying wings, but there should be mechanisms to take care of these vulnerable people. Another issue not worth mentioning, First Deputy Speaker, sir, is the proposed sin taxes. There's proliferation now of shisha. So shisha is artificial cigarettes, mostly smoked by our youths, girls and women. Sorry? Thank you very much. Thank you. First Deputy Speaker, sir. First Deputy Speaker, shisha is another issue that we need to consider putting a levy on that one, because it is also contributing significantly to lung diseases. Yes. With these few remarks, First Deputy Speaker, sir, I wholeheartedly support all honourable members who have supported this report. And please, let's encourage our girls and boys to refrain from shisha. Yes. Thank you very much. I beg to report, First Deputy Speaker, sir, that our report be adopted by the whole House. I beg to report. Thank you.
Honourable members, we have a motion on the floor coming from the chair. The motion is for the House to adopt the report by the chairperson of the Health Committee. Those of that opinion say aye. Aye. Those of the contrary opinion say no. The ayes have it. The motion is carried. The report has been adopted. Congratulations, Health Committee. You've taken a good pace. Leader?
First Deputy Speaker, I would like to request your office that we handle general business item C, which is presentation of delegation report. But as we do that, I would like to join your office in congratulating newly elected members of this August House, namely Honorable Matthews Shinombo Mtumbuka, Honorable Tokozi Lunji, Honorable Patrick Siabonga Bandawe, and the Honorable Mavuto Mapongo Goro. On behalf of the House, I would like to say congratulations and welcome to the House of the People. Congratulations once again. I submit, First Deputy Speaker.
Thank you very much, Leader. And indeed, just to say, when Honorable Bandawe was not in the House and Honorable Lunji were not in the House, we celebrated your victory as a House, and the Speaker had a very good message that has been announced here. So I'd like to congratulate, I don't know if Honorable Lunji is in the House right now. Can you please rise, Honorable Lunji? And Honorable Bandawe, please rise. Honorable Bandawe. Thank you very much. Let's resume our seats, honour members. Order. Palombe North. Palombe North. Please, you have to take permission from Chirazolo Nyungwi for you to do what you are doing. Thank you very much.
General business, presentation of delegation report. The Honorable Member for Blantyre Sochi Zingwangwa to present a delegation report to the Pan-African Inter-Party Dialogue held in Maseru, Lesotho from 10th to 11th December 2025.
Honourable Member for Blantyre City Sochi Zingwangwa constituency.
Yeah, thank you, Mr. First Deputy Speaker, sir. I beg to present the paper standing on my name under item 2C of the order paper. Thank you.
Thank you. Commissioner, please switch off your microphone and keep rising. Maintain your position. Sergeant Adams. Leader of Delegation, Blantyre City Sochi Zingwangwa, do you want to speak to your report?
Yes, Mr. First Deputy Speaker.
Please, Commissioner, proceed.
Thank you. Good afternoon, Mr. First Deputy Speaker, sir, and honorable members. It gives me great pleasure to stand before this august House to present a report of the Malawi delegation to the Pan-African Inter-Party Dialogue, which was held in Maseru, Lesotho, from 10 to 11 December 2025. Mr. First Deputy Speaker, sir, I wish to appreciate your office for allowing representatives from various political parties to attend this meeting. I also wish to appreciate my fellow honorable members for Chirazulu Nyungwe and Chisi North for their contributions during the conference. Mr. First Deputy Speaker, sir, the Pan-African Inter-Party Dialogue, which was held in Maseru, Lesotho, was held under the theme entitled Advancing Governance through Strengthening Democratic Resilience for Early Warning and Conflict Prevention. The conference provided an opportunity for the parliamentarians from the SADC parliaments to share perspectives on how political parties can promote inclusivity and administer early warning systems to strengthen democracy and prevent conflicts. Mr. First Deputy Speaker, sir, during the conference, discussions focused on how unconstitutional changes of government undermine governance, peace, security, and sustainable development, while emphasizing the role of political parties in early warning systems and conflict prevention. Participants discussed how coups and unconstitutional transitions erode institutional legitimacy and weaken rule of law, triggering political violence, repression, and regional instability. As a result, this disrupts economic and sustainable development. The discussion therefore highlighted proactive measures to anticipate risks before they escalate. Mr. First Deputy Speaker, sir, it was observed that in certain instances, key negotiators, including political party leaders, United Nations agencies, and PIPID, have either overlooked or undertaken insufficient measures to prevent conflict before it erupts, as evidenced during the elections in Mozambique and Tanzania. Mr. First Deputy Speaker, sir, both ruling and opposition parties were therefore urged to act as architects of Africa's democratic future rather than reactive actors. Calls were also made to reinforce constitutional frameworks and discourage military interventions in politics. Mr. First Deputy Speaker, sir, the parliamentarians also held a discussion on inclusive governance through women's political participation and representation. The delegates emphasized the importance of inclusive governance by strengthening women's political participation and representation, highlighting the need for gender-responsive reforms to advance peace-building and community resilience. Mr. First Deputy Speaker, sir, the delegates attributed the persistent underrepresentation of women in political leadership across Southern Africa to various reasons, such as deep-rooted patriarchal norms, resource constraints, and political resistance. Our delegation shared how party leadership in Malawi had actively nominated and supported women for key positions, such as speakers, deputy speakers, vice presidents, and cabinet ministers. As a resolution, political parties during this conference pledged to review internal structures and nomination processes to ensure women's inclusion. They called for legislative quotas and reforms to guarantee equitable representation in parliaments and local councils. Mr. First Deputy Speaker, sir, delegates at the Pan-African Inter-Party Dialogue also held a panel discussion on the topic entitled Youth at the Driver's Seat, Reimagining Political Participation in Africa, where yours truly and fellow young MPs from other SADC parliaments led the discussion. Mr. First Deputy Speaker, sir, the discussion highlighted the challenges which the youth experience within political party structures that sideline their participation, such as limited access to political platforms and entrenched age-based hierarchies that favor older elites. The participants acknowledged the link between youth involvement and early warning systems and peace building, recognizing their role in detecting and addressing tensions before escalation. Mr. First Deputy Speaker, sir, adding to the issues raised, I reported that in Malawi, limited business and employment opportunities for the youth have a direct link with political party participation, as the youth are not economically empowered. This was the same reason I rose up in this House, Mr. First Deputy Speaker, sir, a few weeks ago, urging the government to facilitate the monetization of social media in Malawi in order to ensure that young content creators and influencers earn money through their social media accounts and ultimately economically empowering them. It is also against this background that I wish to commend this government, including the President of the Republic of Malawi, His Excellency Professor Peter Mutharika, Minister of Information and Technology, and the Malawi Communications Regulatory Authority, MACRA, for considering this proposal. This is a positive development, Mr. First Deputy Speaker, sir. Mr. First Deputy Speaker, sir, furthermore, participants at the PIPED also examined the process through which political parties are established, the formation of party coalitions, and the reasons members often break away to create new entities. During the discussion, it was observed that many parties emerge or fragment largely due to greed and corruption. Such tendencies, according to the participants, contribute to the inability of political parties to effectively deliver on their mandates. Failure to provide viable solutions fosters conflict, mistrust, and weak citizen participation in political affairs. Participants therefore emphasized the importance of political parties being held accountable for their actions by professionalizing their organizational structures, strengthening citizen engagement, utilizing evidence-based data, and harnessing technology to promote intra-party democracy. Mr. First Deputy Speaker, sir, in light of what transpired during the PIPED, which was held in Maseru, Lesotho, the Malawi delegation made a number of recommendations for consideration by the relevant stakeholders as follows. 1. Political parties in Malawi must strengthen youth and women engagement by creating youth and women caucuses with real influence in decision-making. 2. Political parties in Malawi should aim to establish research and policy units to collect and analyze socioeconomic data and use national statistics, surveys, and independent research to shape party manifestos. This will ensure that policies respond to real needs of Malawians rather than assumptions. 3. In light of Malawi's growing reliance on political party coalitions, it is essential that these alliances embrace stronger accountability measures. Coalitions should not only serve as vehicles for electoral success, but also as frameworks for transparent governance, where commitments are clearly defined, responsibilities are shared, and citizens can track delivery against promises. And finally, considering the role that the African peer review mechanism and the Pan-African inter-party dialogue play in strengthening democratic resilience in African countries, the delegation recommends that the Office of the President and Cabinet should consider signing a memorandum of understanding with these institutions to work with political parties in Malawi to support inter-party dialogue and encourage reforms that enhance citizen participation. In conclusion, Mr. First Deputy Speaker, sir, delegates gathered at PIPED in Maseru, Lesotho, acknowledged the critical role that political parties play in conflict prevention and resolution. They acknowledged that inclusive intra-party governance is crucial in achieving this. The conference therefore provided an important platform for the delegates to share experiences and learn best practices from other political party leaders from SADC region. I therefore move that this report of the Malawi delegation to the Pan-African Inter-Party Dialogue, which was held in Maseru Lesotho in December 2025 be noted by the House, I beg to move. Thank you.
Thank you very much, Honorable Commissioner and the lead of delegation. Honourable members, we need members to comment on the report, and the floor is open for the House to comment on the recommendations that have been made by the presenter. Any takers on the floor? I see the honourable member for Nchisi. I see the honourable member for Chikwawa West. You have the floor.
Thank you very much, First Deputy Speaker. I would like to raise a concern that during the meeting they were discussing about women in politics and other issues about women. But the delegation, they were only men. Is it in order, First Deputy Speaker, that 3 men travels to Lesotho and discuss about women, leaving us here in Parliament? Is it in order? Thank you very much, First Deputy Speaker.
I recognize there's a Kasina for another point of order. Then I'll make my ruling.
Thank you so much, First Deputy Speaker, for recognizing people of the Kasina. Chair, is it in order that the member who has just resumed her seat should reflect on speakership and should reflect on our fellow youth? Because the delegation which in there, they are the youth. Yes. They are representing the youth there. And they are discussing things, not discussing about, but discussing issues to do with youth in politics. Youth in politics, it includes women and men. So the youth which went there, they are the youth which represent this House. And our standing order says you cannot reflect on chairmanship, on the speakership. Is it in order, Mr. Speaker? But also we don't speak about, discuss about, we discuss. I submit, Chair.
There's a Kasina. Thank you for that contribution. I take that as your contribution. For the point of order raised by Chikwawa West, your speakership will always do better. And we will do better. We promise we will do better for the future. Women form part of this House, and all the speakers, the 2 male speakers, the Right Honourable Sami Gafar Suleiman and myself, we are he and she champions. We will promote the plight of women in leadership starting from this House, and we will do better. It is a promise we are making. Thank you very much. I see the honourable member for Lilongwe. Honourable member at the back.
Lilongwe Msinja South.
Lilongwe Msinja South. You have the floor.
Thank you, First Right Honourable Speaker. Our people of Lilongwe Msinja South would like to contribute on the youth financing. My contribution is from a promise to policy. Why Malawi we need to debate something to do with youth financing law. Right Honourable Speaker, it is a fact that Malawi's future is closely tied to one defining reality, that this is the youth nation. With a large share of its population, Right Honourable Speaker, under the age of 35, a country holds a significant potential for economic growth, innovation, and social transformation. But, Right Honourable Speaker, the first, for many young people, this potential remains largely untapped due, number one, persistent barriers, particularly limited access to finance. First, Right Honourable Speaker, in the recent months, we have been discussing as a youth caucus that we need to empower our youth. And as of now, it has gained a renewal attention, especially following the government efforts, number one, to increase funding on youth-focused initiatives and the allocation such as Youth Innovation Fund and also constituency-level youth loan programs. That is signaling that a growing recognition of the need to invest in young people. This initiative, Right Honourable Speaker, the first is an important step forward, providing opportunity for entrepreneurship and income generation. But we have a policy question. Are these efforts enough to create a lasting and equitable impact? Currently, our youth financing in Malawi is largely driven by, number one, government programs, number two, donor-funded projects, and lastly, interventions that do not come frequently. While this supports a number of beneficiaries, but they are often limited in scope, unevenly distributed, and it is dependent on changing priorities and available resources. As a result, Right Honourable Speaker, the first, many young people, including those from Lilongwe South, continue to face challenges in accessing consistent and reliable financial support. These are recommendations from our people of Lilongwe South, Honourable Speaker, that we need to start debating on the idea of a youth financing bill. The youth financing bill, much as it is not an official piece of legislation before Parliament, but it's an emerging policy framework which is being discussed by youth organizations, development stakeholders, and some policy makers, including the Youth Caucus. The proposal seeks, number one, to move beyond temporary programs and establish a legally binding framework that would guarantee structured and sustained financing for young people at both national and district level. Right Honourable Speaker, the first, the idea argued that the law could address some of the key weaknesses that we have in the current system by embedding youth financing in legislation. It will reduce uncertainty and ensure that funding is dependent on annual budget decisions or external support. It would also provide a clear structure for managing funds, selecting beneficiaries, and monitoring impact. One central feature being discussed is the creation of National Youth Financing Fund, complemented by district youth funds. This approach, Honourable Speaker, aims to improve coordination while also ensuring that young people in different parts of the country can benefit more from the fund. I know, Right Honourable Speaker, that we need to practice a principle of transparency and accountability and regular audits and public reporting. These measures are intended to strengthen trust in how resources are managed and ensure that funds reach intended beneficiaries. Despite these potential benefits, the proposal also raises important consideration. A key issue is financial sustainability. Establishing a legal framework for dedicated youth funding, such as allocating a fixed percentage of national budget, would require a serious and careful planning to balance competing national priorities. Malawi, like many countries, faces multiple demands on its limited resources, including health, education, and infrastructure. Lastly, Right Honourable Speaker, the discussion around youth financing bill should reflect a broader shift in thinking. It highlights a growing recognition that long-term solutions may require not only programs, but also strong policy and legal frameworks. As Malawi continues to explore this idea, this focus will likely remain on finding a balanced approach, one that combines sustainability, consciousness and accountability. Whether the proposal eventually becomes a law, or another form of intervention, it has already contributed to an important national conversation. Lastly, the debate is not only about legislation, it is about how Malawi chooses to support its young population and its plans to harness the opportunities presented by its structure. I think going forward, we need to bring the bill and we need to discuss the financing law for the youth, and this discussion marks an important moment, one that could shape the country's development path for years to come. Thank you, Right Honourable Speaker, and I support the report. Thank you very much.
Thank you. The honourable member for Lilongwe Kampuno. You have, is that Lilongwe Kampuno standing next to Sinja South?
Yes, Mr. First Deputy Speaker.
Yeah, please. You have the floor.
Thank you so much, Mr. First Deputy Speaker, for granting the beautiful people of Lilongwe Kampuno constituency to contribute on this. I really support the report, and especially when they have emphasized on strengthening the women in practice of politics. I think this has been a song for years in Malawi that we always encourage women to practice politics, but we don't have like an action which has been taken. Now, for these next 5 years, as women in Parliament, now, as I'm talking of today, we only have 21% of women in Parliament. So we'd like to emphasize the committee also to take an action on it, even this Parliament to take an action on it, especially you, the First Deputy Speaker. We know that you love women in this Parliament building, and you always support us in this Parliament building. So we have to take that further. We have to take that further so that next cohort, we should have 50-50 here. Not only men should come in this Parliament building. We have to support women.
Honourable member, be assured you are not reflecting on the chair. I seriously love all women here, and to assure that I love you too. Thank you.
Thank you so much, First Deputy Speaker. So on that, you have to support us. It should not be just a song. Even the CSOs, even the Women Caucus, we always sing about encouraging women. So we need to make an action. We need an action in this. We need to make an action in Malawi so that women should be more than men as well in Parliament building. So Lilongwe Kampuno constituency is supporting the report so much. Thank you so much.
Thank you. Thank you. I see leader rising.
First Deputy Speaker, I beg to move that debate on the report be curtailed to allow for the mover to wind up. I beg to move.
First, we have a motion on the floor. The motion is to curtail debate on the delegation report, so we allow the mover to wind up. Those of that opinion say aye. Those of the contrary opinion say no. The ayes have it, the motion is carried. Honourable Commissioner for winding up.
Thank you, Mr. First Deputy Speaker, sir. I would like to thank the whole House for supporting the report. Mr. First Deputy Speaker, sir, what is key through the report and through our participation is peace, conflict, inter-party dialogue, intra-party dialogue. Now, where are youth and women coming in? Youth, when it comes to violence, political violence, youth are usually, used, weaponized, and champions of violence. Women are victims. Mr. First Deputy Speaker, sir, the just ended elections when all of us were going to the polls with 50+1, others expected we'll have a rerun. But fortunately, we would say we had a winner outright. But now, what lies ahead of Malawi? With a 50+1, a day might come when we might not have an outright winner and we might be required to go second round. We don't have a law that safeguards coalitions and alliances. We had Tonse Alliance, it ended up in tears. Now, moving forward, Mr. Speaker, sir, Mr. First Deputy Speaker, Mr. First Deputy Speaker, it is in our best interest, all of us here as politicians, it is in our best interest as political parties. We know 50+1 is a law. We know there are chances we might field candidates who cannot get 50+1 first round. We must make sure before the general elections we have a law that safeguards coalitions and electoral alliances so that moving forward, issues of trust should be dealt with by the Constitution and the law. I beg to move. Thank you so much, First Deputy Speaker.
Thank you very much. Well, thank you very much, Commissioner. Please switch off your microphone. Switch off your microphone. Thank you very much, Commissioner. You've concluded with a pertinent question. And honour members, I would like to move that this report, delegation report, be agreed to, be noted. Those of that opinion say aye. Those of the contrary opinion say no. The ayes have it. The report has been noted by this House. Thank you very much. Congratulations, Commissioner. Honour members, it is 15:43. I'll be suspending soon for a health break. But in a special way, Leader, I want to recognize the honorable members of your House that are from the Lower Shire. Can I ask those that are coming from the Lower Shire that are still in the House to rise now? If you are still here, please rise. And you honor members are heroes of the disaster preparedness, and you have fought the disaster because your constituencies have been affected hard. And we would like to applaud you for the work well done. And we owe you an applaud by the House. Honour members, we can do better. Let's give a hand of applause to the people of the Lower Shire for the job well done. Thank you very much. It is 15:44. I suspend proceedings for a health break. The House will resume sitting at 16:15. House suspended.
Luntha Television stands as an autonomous faith-based broadcaster with a national and international reach. Experience the difference with Luntha Television, where innovation meets experience. Authenticated team backed by cutting-edge technology ensures seamless execution and unparalleled results. Luntha guarantees credibility and professionalism in all its endeavors and services. We offer, among this, production and broadcasting of jingles, music videos, narratives, documentaries, press services and programs, on location or outside, live broadcasting of mass and other church functions, government or NGO functions, and political rallies, creation and broadcasting of special programs, sponsored content, sports and entertainment, and advertising for small, medium, and large enterprises.